neurosurgery PA. That just didn't make any sense to me at the time because I always knew that doctors had to go through this rigorous route of like picking. So one of the PAs that I was working with, I'll mention him. His name was Kevin. He was working in the neurosurgery practice as well. He
Mhm.
mentioned that he also did orthopedic was it surgery? I don't know, but
Mhm.
he was in the orthopedic field, he had told me. And I was like, how are you doing that simultaneously with being a neurosurgery PA? That just didn't make any sense to me at the time because I always knew that doctors had to go through this rigorous route of like picking, like once you went through medical school and you picked like a specialty, like that was just it. You know, you had to focus on that throughout residency and then that's where you would stay. But the fact that he mentioned, you know, he was able to go back and forth between neurosurgery and I think it was orthopedic surgery, if I'm not mistaken. I was like, oh, tell me more because I'm very much like I like to consider myself, and from what I hear from other people, I'm like kind of like a jack of all trades type of person. So I like being able to know a little bit about everything and still have the skills to do everything, you know? So once he said that, I was
Mhm.
like, okay, I really like that I would be able to like not profession, sorry. I really like that I would be able to change specialties or do multiple specialties, like two at a time, if like that's my desire at the time, or if that's something that aligns with the needs of my community. That really intrigued me. So yeah.
I think they call that ADHD,
You know
right? Like
what?
where you just like want to do everything at the same time.
Yeah, low key. Yeah, I low key do think I have some ADHD
Mhm.
tendencies.
I think we all do.
Yeah.
Like literally everybody in your class, everybody in my class, myself included, we all have it. And we put it to good use by being in medicine. Because I noticed that, like, especially at work, my work is designed in a way that I have to be doing five different things at the same time, but none of them get done at the same time. So it's like I have to see a patient, then I have to chart on the patient two patients ago, and then I have to do labs for a patient 2 weeks ago, and then I have to call somebody that's calling back from last night, and it's like I'm doing this all at the same time, and then someone's always going to pull me away about another patient, and like it does drive you crazy. But somebody without ADHD could not handle it. There's no way,
I agree.
because like we've been living like this with this chaos in our head since we were like one, and then like people who don't have that kind of chaos in their head, they can't handle medicine. So
Right.
it's like a
I
superpower.
agree.
Absolutely.
I know, I agree for sure. I agree for sure.
Yep. Which makes PA even more perfect because, like, let's say you get very good at orthopedic surgery. You're very good with joint injections. You're good at helping out with, like, you know, disc replacements if it happens to be a spine surgeon too. What do you call it? Shoulder, knee, whatever, hip replacements. And then that's all you do. Well, wouldn't it be cool to also do like all the stuff that neurosurgical PAs get to do and round on those patients? It's just like more to do, but it's more interesting,
Right.
you know?
I
So yeah, I
agree.
definitely appreciate that aspect. So
Oh,
now
for
we
sure.
definitely understand YPA. How did you, once you finally decided, okay, this is what I want to do, you probably looked and you were like, crap, it's really hard to get in. So now what?
I'm not even gonna lie. I was actually very taken aback by like the process of applying and like knowing your chances of getting in. That really surprised me. Like especially the fact that a lot of PA schools they prefer that you get experience before you go to PA school. And I was like, dang, like I don't really have a lot of experience. Like when I was in college, I didn't really have a lot of clinical experience. So I was just like, oh my God, what am I gonna do? It was a huge like shock factor. But that's when I guess like I just started getting on my laptop, watching videos. Like from that, it was a wrap. I was like, okay, I know I want to go to PA school. At this point, is my degree going to fulfill the curriculum requirements? Like that was the first and foremost thing, which I ended up messing up there too because I didn't take microbiology in college, which is so odd. But I also didn't take anatomy and physiology because I had a general bachelor's degree in biology. So they didn't offer A&P. And so it was a whole process. It was a whole thing. And then trying to get clinical experience and The volunteer experience, I'm not gonna lie, I was pretty good with because of like undergrad and high school and stuff like that. But yeah, everything else, it was a big shock. It was a lot to go through everything. And then on top of that, like not, I guess, have someone to tell me exactly what to do. Like that was the hardest part.
Hmm. Yeah, that's what I was thinking when you were saying definitely about the A&P thing, because somebody who like knows what it takes ahead of time, they would have said, no, you need to take this too, look at the prereqs. And then getting your experience. Like I had a bunch of pre-meds in my college who did CNA. There was like a local nursing home and they got all certified and they got like hours and hours and hours like during school basically, and their classes even worked around it so they can get more hours. And then
Wow.
like looking back on that thinking like, man, that is perfect, why didn't I do that? Because no one told me. I was thinking
Right.
like, you guys want to wipe old people's butts? That sounds awful, why would you ever want to do that? And then sure enough, 5 years later, that's what I'm doing, but as a much older person going like, man, I wish I would have done this earlier.
Right.